Let's look at the muscles of mastication, their attachment points, discuss their function and their nerve innervation. The first one I want to show you is the most lateral of them all, and is usually the thickest. It originates from the lateral aspect of the angle of the mandible, inserts into the inferior border of the zygomatic arch. This is the masseter muscle. The masseter muscle is innervated by V3, motor branches of V3, which is the mandibular branch of trigeminal. And its function is to help in mastication. If we take another specimen here, and we talk about the medial and lateral pterygoid muscles, we can see those here on this guy. So the mandible has been cut away, whereas normally the mandible would come out and up, right? The muscle fibers that are going a little bit more vertically are the muscle fibers of the medial pterygoid muscle. The medial pterygoid muscle originates on the medial surface of the lateral pterygoid plate and inserts into the medial aspect of the angle of the mandible. Innervated by motor branches of V3, the mandibular branch of trigeminal, and its function is to aid in mastication. The fibers from the medial or from the lateral pterygoid plate that end up going more horizontally are the fibers of the lateral pterygoid muscle. The lateral pterygoid muscle originates from the lateral surface of the lateral pterygoid plate and inserts into the pterygoid fossa, which is just below the condyle on the medial surface of the mandible. Lastly, the other muscle of mastication that you need to know about. This isn't a great example of it, but I'll show it to you anyways. And you can see some of the fibers that are underneath the fascia here on the skull. The last muscle I'm talking about is temporalis. And temporalis will, and this guy's mandible, the ramus of the mandible has been cut away as well. So the mandible, this is the mandible here. It would normally come out and up, right? The temporalis will insert into the coronoid process right in and around this area on the mandible. It will go underneath the zygomatic arch, which is normally right here, and it will fan out onto the faint temporal lines of the parietal bone and some of the frontal bone. All of the muscles of mastication are innervated by mandibular branch of trigeminal V3, and they all help to aid in mastication. Worth noting, however, on this guy, just as I think of it, all of the muscles of mastication help to aid in mastication and chewing and essentially closing the mandible. The one that is a little bit different is the lateral pterygoid muscle, and its function is to more roll the jaw and allow for the grinding of the teeth, and it more like some kind of mandibular or jaw protraction, okay? Because their fibers run a little bit more horizontally and allows for when the contraction of this muscle happens, the jaw moves in and out, okay? Whereas the other muscles are responsible for bringing the jaw, elevating it this way and allowing for chewing.